Welcome to Houston Methodist Facebook Live. We are here this month with Dr. Bincy Abraham. She is a gastroenterologist with Houston Methodist Hospital. Welcome, Dr. Abraham.
Thank you for having me.
So if you have any questions for Dr. Abraham, feel free to leave them in the comments section below on the Facebook page. So doctor, I've always wanted to ask a gastroenterologist. You went to medical school, you had all of these other options, and you chose gastroenterology. What made you want to do that?
Great question. Well, as you know, it's a dirty job, but somebody's got to do it,
It
right?
sounds like it is a very dirty job. Yes, it is.
No, on a serious note, I like the component of doing procedures and also the medical aspect of seeing patients in clinic as well. It's a combination that drove me to that.
Okay.
Yeah.
So it doesn't matter how old we are, what we look like, good looking, bad looking, whatever. We all have to go to the bathroom. And some of us have problems from time to time. So what is it, what are some of the basic signs that something is not right in your gut?
Yeah, so our gut's main job is for us to process the foods that we eat and provide nutrition for the rest of the body. So obviously if you're eating and not gaining weight or losing weight despite eating normally, or going to the bathroom too often, having diarrhea, or there's blood in the stool, those are lots of signs that something is not right with your GI tract.
So say someone has blood in the stool or something like that, what should they be doing at that point?
Yeah, so sometimes there could be some simple answer, like it's like a hemorrhoid, which is a swollen blood vessel that causes a little bit of bleeding and it resolves. But I'm more concerned about bleeding that continues to occur, doesn't stop, where you can actually lose a lot of blood and become anemic, feel short of breath, and not fatigue, feel pretty badly. And if it continues, that needs to be evaluated.
So some of us will have stomach cramps sometimes as well. So when is a stomach cramp more than just you ate something or ate too much, and then when does it become serious?
Yeah. Well, first of all, if you ate something that was bad, or someone else that you were eating with felt bad too, then it's probably something related to the food that you ate, some infection related to that, and typically that goes away. If it doesn't, if it persists, then that's a concern. Now, sometimes an infection can last from a few hours to a few days, but after several days, and if it's still persisting, or at least that if you notice that it's not getting better, that's when you need to be evaluated. Yes.
Food poisoning is a big problem for a lot of folks, correct? And I'm sure you see that all the time. What are some ways that people can, when they figure out that they have it, what is the best course of action for them to get rid of it?
So if you have food poisoning, the key is to get all the poison out of the system. Often your body will take care of that by vomiting or diarrhea, and once the toxins are out, then you start feeling better and eventually get back to normal. Of course, the best thing is to avoid foods that are really bad, but sometimes you don't know what you eat is really good for you or not, or if there was an infection or a bad bacteria or virus in it. So if you do get exposed, the key is to stay hydrated, because often what can happen is you get vomiting, diarrhea, and you feel bad, not only just from the symptoms, but from dehydration itself. The key is to stay hydrated when that happens until all the toxins are out, and then you're able to eat normally.
So there are a couple of things that people might have. One, irritable bowel syndrome, the other, inflammatory bowel disease. Can you tell us the difference between the two?
Yeah, so those are two different diseases or syndromes that gets confused quite often. So inflammatory bowel disease is an inflammatory condition. It's comprised of two main diseases, such as ulcerative colitis or Crohn's disease. Now, ulcerative colitis mainly affects the colon only, doesn't affect the rest of the GI tract. On the other hand, Crohn's disease can affect anywhere in the GI tract, from the mouth, the esophagus, stomach, small intestine, the colon, and even outside the colon area called the perianal area as well. And that causes inflammation, where we do a colonoscopy and we can see ulcers in the colon or in the small intestine. We can see other complications such as inflammation, bleeding, or sometimes even strictures or narrowing in the GI tract itself. And so those are very concerning signs where we need to get those patients treated pretty aggressively so we can resolve all that inflammation so they don't get into further complication from the disease. And some of these complications can be as serious as colon cancer or strictures or bowel obstructions where nothing is going through and a patient requires surgery. Often, if we get them our medications appropriately treated, so get them appropriately treated early on, where we can avoid all the complications, and most of our patients can lead a completely normal, healthy life. Now, it's when we get to the medications or treatment too late in the game where all the complications can happen, and it makes medical treatment less effective. Now, on the other hand, irritable bowel syndrome, there's not necessarily inflammation. If we do a colonoscopy or endoscopy, we see completely normal looking bowel. But patients have symptoms such as abdominal pain along with either diarrhea, constipation, or an alteration in those bowel habits. And that's highly linked to our mind-gut connection and stress. So we call it more of a functional disorder. Doesn't mean patients don't have symptoms and can be pretty debilitated from the condition. There's no inflammation involved. It's more of a clinical diagnosis where you have pain along with some changes in their bowel habits.
So we have a question from David in our Facebook universe. He wants to know what the best over-the-counter medication to take for IBS or colitis might be.
So now the key here is to differentiate between IBS from colitis, from ulcerative colitis or Crohn's colitis. If it's from IBS, the first key thing is to figure out what's triggering that. As I said, there's a huge mind-gut connection. So if our body is stressed, or if we're undergoing mental stress or work stress or family stress, that's always going to trigger sometimes our GI tract, and so we have to treat that underlying problem. Now, I always kind of joke, I wish I could write a prescription to say, hey, no more stress, and then all the world's problems will be over. Sure. Unfortunately, that can't happen, but really over-the-counter for IBS, really treat the underlying stress, and that may be taking care of the underlying issue, or it could be also finding ways to relieve stress. That could be exercise, adjusting your diet, or getting enough sleep, or even something simple as mindfulness or meditation to calm down our mind from our day-to-day stress so our gut can calm down as well. Now, you can use things such as probiotics, which are good bacteria that you can find in yogurt, to over-the-counter medications that can help with that. Eating plenty of fiber can also help with IBS. Now, on the other hand, if you have colitis, the key is to figure out what type of colitis it is. If it's inflammation from a bug or bacteria or virus, typically we can treat that with either some time while the body gets rid of the toxins, or with antibiotics. If it's inflammatory bowel disease, such as ulcerative colitis or Crohn's colitis, that needs to be evaluated and treated accordingly, and that's based on how severe the disease is. If the colitis is mild, you may be able to get away with milder medications. If it's severe, then you'll need stronger medications, and that you will leave up to the gastroenterologist to make that decision.
So is medication basically the best way to take care of Crohn's disease or ulcerative colitis?
Yes, for the most part. We have looked at non-medical therapies for this, such as using probiotics, but for the most part, probiotics can help with keeping patients in remission once they achieve that. We haven't found great evidence that probiotics can help with treating severe active inflammation. So really we have to work on treating the underlying inflammation component. Now, having said that, eating a healthy diet can also be beneficial in that we provide a good microbiome or good bacteria to our gut for more long term, because we know that our bacteria in our gut can actually interact with their immune cells, and if you have too much bad bacteria, then there's too much immune activation in our cells, which contributes to more inflammation. But on the other hand, if you try to control with eating better foods and improving having a better microbiome or a good bacterial environment, that may actually suppress or reduce inflammation as well.
So David also wanted to know, you were talking about eating good foods for IBS. What are those good foods you're talking about?
Yeah, so overall eating healthy would be high fiber. As a gastroenterologist, most gastroenterologists would say, well, we don't eat enough fiber in our American diet as some other countries. So eating plenty of fruits, vegetables, and we all know the health benefits of eating fruits and vegetables, from antioxidants, getting the fiber and all of that. Now, sometimes you have lots of inflammation. A lot of my patients can't tolerate too much fiber in their diet, so we have to keep them on a low residual, low fiber diet initially until we get the inflammation under control, and then they can eat much better, eat healthier in that aspect. The other component of diet, we actually did a study looking at all patients prior to them getting diagnosed with inflammatory bowel disease. What we found was that there was a higher risk of developing Crohn's or colitis if you actually had a low fiber diet, low fruit and vegetable intake, and high red meat intake, so high fat diet as well.
Okay.
So if you want to have any environmental influence in trying to reduce the risk of developing IBD, one thing we can all do would be eat healthier, of course, eating higher fiber, fruits, vegetables, reduce the amount of high fat, high red meat intake. That doesn't mean you can't have a steak once in a while,
Yeah.
but just don't eat it on a daily or weekly basis.
What about some of the things we drink? I would imagine water's got to be the best thing, right?
From staying hydrated,
Yeah.
sure. Now, a lot of the things that we drink includes a lot of sugars, so the sodas that we take, and there's also a lot of evidence that diet sodas, there's the dietary component, which is like the non-absorbable sugars or the really high fruit, not necessarily fructose, but a lot of the substitute sugars can also change our microbiome, and could that trigger some inflammation? We just don't know. Of course, we need to have a lot more studies looking at it long term to look at that,
Right.
but it's looking like, based on all the prior evidence that we have, or the more recent evidence too, that maybe the diet sugars are not necessarily as good for you as we thought it would be.
So in other words, like my 6 or 7 Diet Cokes a day is not a good idea?
Probably not. You might want to cut that down.
Okay. All right. So Marcella, you talked about eating healthy and a kind of high fiber diet. She was wondering, is eating bran all day, every day, a good idea?
Okay. Well, everything in moderation, right? So if
okay.
you only ate bread and that was your only dietary intake, well, you're going to be losing out on a lot of other nutrition from other foods. But eating bran on a daily basis as part of your routine foods that you take, that should be fine. Yes, if you can tolerate that and you enjoy eating it, or you take it because you want to include the fiber, that's perfectly fine.
Okay. Marcella also had another question. What is a regular frequency for bowel movements?
Yeah, so there's no right answer for each person. It can vary. So technically, having 1 to 2, maybe up to even 3 bowel movements per day can be normal. I would say probably 1 to 2, but you can have one every other day, and that could be normal as well. Now, we get to extremes when we'll say someone has constipation if they're having less than 3 bowel movements a week. So keep that into consideration. So if you have a bowel movement every other day or every 2 days, this actually can be normal. If you have one 1 to 2 times a day, can be normal. If you start to get into the other extremes, then we need to start looking into more of diarrhea or constipation. Yeah.
One other question we had from Marcella, she wanted to know about tomatoes, actually.
Okay.
She wanted to know if they should be avoided to reduce stomach acid, and if so, why?
Yeah, so tomatoes have a lot of acid in it, so a lot of patients who have stomach ulcers or have issues with the stomach may not be able to tolerate it, but it doesn't mean you can't have your tomato juice to tomatoes to spaghetti sauce. Okay. So if you can tolerate it, sure, that's not a problem. Now keep in mind, whatever you eat or drink, your stomach pH is very acidic, to a 1 to 2. So no matter what you eat, it's going to turn acidic once things get to the stomach, because that's how we actually digest our food. Now, of course, if you have ulcers or gastritis or inflammation in the stomach, you may get treated with acid blocking medication where it increases your pH. So if you're already on a medication for some stomach-related illness, and you take acidic foods, of course you may feel worse because of that component.
So you mentioned this before, but Veronica from the Facebook universe wants your take on probiotics.
Okay, so probiotics. It can be beneficial in irritable bowel syndrome, where it can help with some symptoms such as bloating or pain or your changes in your bowel habits. In inflammatory bowel disease, the best evidence that we have for probiotics is in patients who have pouches, which are when patients who have had colons removed and the surgeon creates what we call a J pouch, where it's creating like an area where the stool can stay and is made from small intestine and is attached to the anal area, so you can have normal bowel movements. Now, sometimes you can get inflammation of that pouch just from changes in our diet, microbiome, genetic differences. And if you get that and you get treated, probiotics can help with that. And also, if you have had pouch ulcers in the past, probiotics can actually help prevent or reduce the risk of you developing it again. That's like the best evidence that we have with using these probiotics. Now, if you have general ulcerative colitis, the second best evidence is to help maintain you in remission. So if you have ulcerative colitis, you're on medications, you're under control, then probiotics can help maintain you in remissions where you don't get a flare again, or at least reduces the risk of that. Now, if you have more severe disease or active inflammation, the likelihood that probiotics are going to help would be very low. It may help with more mild inflammation. Now, on the other hand, with Crohn's disease, we haven't really found any evidence that probiotics works. So probably would avoid it, just taking another medication or supplement if you have Crohn's. But now, if you like eating yogurt and you feel better on it regardless, then of course it's not harmful and it's okay to take as well.
Well, Rachel wants to know if there are any new medicines or therapies for inflammatory bowel disease on the horizon.
Yeah, so right now, well, of course, I wouldn't want anyone to have inflammatory bowel disease, but right now we're doing multiple different clinical trials or different mechanisms of action of treating this disease. So we as gastroenterologists or IBD specialists, we're quite excited. In the near future, we'll have multiple medications available, and we hope that we actually can specify it to each patient. And so maybe we can do genetic testing down the line, colon biopsy testing, and we'll know exactly which medication will work best for that individual patient. That's really the future where we're working on. Yeah. So in the past, if you think about 5, 10, 15 years ago, we had barely 2 to 3 medications, and now we're getting to 5, 6, 7. In the near future, we'll have probably 10 more, so we're quite excited about that.
Any cure on the horizon for this kind of stuff?
We're still working on it.
Okay.
Of course, I would love to cure any chronic disease on our to-do list, right? The difficulty is we still haven't figured out what causes inflammatory bowel disease. Once we figure that out, then hopefully we can get closer to the cure. But that doesn't mean we're not working on it in patients who currently have it. So we think that inflammatory bowel disease occurs from a little combination of some genetic factors, but we don't think that's the biggest component. Some type of environmental trigger. That one we haven't figured it out. Is it something in the diet? Could be something that our microbiome changes, but what caused that? There's something in the air. Is it something with what we're exposed to otherwise? So there's a lot of these environmental factors that's really hard to study because they're so variable. So that's another component. And the other component is how our immune system reacts. And so these components here is what's going to trigger the inflammation. But if we can find out what those components are and stop that trigger from causing the disease in an individual, that's where we're going to have our best bet in trying to find this cure.
So you guys are sounds like you're really working hard on it.
Yes, we're, all over the world because this disease has been rising exponentially in a lot of countries where we've never seen it before, especially in developing nations as well. So yes, it's a definite need.
All right, we got a few more questions from folks out there. Jeannie, wants to know if it's possible to have IBS since childhood, or is that something you develop in adulthood?
Yeah, so you can have IBS at any point in time. Of course, it's our mind and our gut connection of how we respond to stress. At least that's how I believe it to come to be. So, and children, you can have it, and adults, we have it too. And just because you have IBS or inflammatory bowel disease doesn't mean you can't have both. So I have some patients who have inflammatory bowel disease who we get them under control and we do a colonoscopy and they're in remission, there's no inflammation, but they still have symptoms. And so we have to work on the symptoms from their IBS that's triggering their pain or diarrhea or sometimes constipation, and we treat towards that. Yeah.
So you may have already answered this question, but I'm going to ask you again.
Okay.
What are the treatment options for Crohn's and ulcerative colitis?
Colitis, yeah.
Kind of tough for me to say that.
Okay. So there's multiple different treatment options that we have currently, along with some studies that we're doing for the future as well. So it all depends on the severity. So if you have very mild disease, some of the medications we use are called mesalamines, which are topical medication that gets released in the GI tract. So we don't really absorb it as much systemically, and it coats the colon and it releases anti-inflammatory effect there and treats inflammation there. We can also use rectal forms of it, either as a suppository or enema, and it can treat very distal, like rectal inflammation as well, or use it in combination. That's for mild disease, mostly for ulcerative colitis. Now, if you have more moderate to severe disease, this is where we start using more immune suppressant medications, things to suppress the overactive immune system, where we've in the past used a lot of immune modulators such as 6-mercaptopurine, azathioprine, methotrexate. We're going away from it for the most part, but we have a lot of patients doing well on it, and which is great. But nowadays, we're actually going more towards what we call biologic therapy, which are immune-specific targeted molecules to treat the inflammation that's causing all the damage in the GI tract. So one of the longest used medications are what we call TNF-alpha inhibitors. So TNF-alpha is a cytokine that's so highly increased when you have inflammation in the GI tract, along with some other immune-mediated disease as well. So these medications go in and block TNF-alpha and suppress that, and we can suppress that target specifically and leave the rest of the immune system alone. We're actually going towards that treatment in inflammation and reduce inflammation, and we actually see healing as well. Yeah.
So you may have talked about this already too, but Sarah wants to know, how do you treat indeterminate colitis?
Yeah. So indeterminate colitis is a subset within inflammatory bowel disease. I spoke mostly about ulcerative colitis and Crohn's disease,
right.
And there's about 10 to 15% maybe of patients we're not sure if it goes one way or the other. Is it Crohn's or colitis? There may be some signs that it could be one, but there's some signs that it could be the other. We're not necessarily sure. But the good news is that we treat it kind of similarly. Now, if you look at what's FDA approved of medications, majority approved for both indications, ulcerative colitis and Crohn's. So really, again, it goes back to, is the indeterminate colitis mild, moderate, or severe? And based on the severity is where we kind of decide on which of these medications we choose to treat it.
Okay. My mom's always told me throughout my life, you have to eat a lot of roughage. Right? So one of our viewers, Kadash, wanted to know, can lettuce cause inflammation?
Yeah. So lettuce by itself cannot necessarily cause inflammation, but if you have inflammation already and you eat lettuce, then it may trigger symptoms. Just because if you have inflammation of your colon, there's ulcers there, and you're eating roughage. Of course, a roughage is kind of attaching next to where those ulcers can be, and can sometimes cause a little bit of exacerbation like that. It's more of a mechanical thing than it being an inflammatory agent. Yeah, it's not that at all.
Okay. What is good gut bacteria versus bad?
Okay. Well, I think I need a PhD or a thesis to go through all of this, right? So there are, it's not necessarily that there's one type of bacteria that we need. If you look, our GI tract is a storage place for the majority of bacteria that we have in our body. If you think about our human cells to the amount of bacteria that we have in our gut microbiome takes over us, essentially. So the key here is it's not necessarily one type of bacteria that we need, it's a good variety of bacteria that we need. If you look at patients that have inflammatory bowel disease, and we see, look at their microbiome analysis, what we see really is that there's less variety in their bacteria flora than someone who has a completely healthy gut. So key is not just having one or two bacteria, it's really having a good variety and having a good number of species and just one specific bacteria. Say, oh, if you eat more of this, you'll feel better. Yeah.
Okay. Yeah. So Jesse wants to know, and I may screw up these names. So,
okay.
What do you think about taking turmeric or cumin supplements when you have IBS?
IBS, okay. So curcumin is an active ingredient in turmeric, and turmeric is a Asian spice. We usually use it a lot for Asian cooking, and it's from this root. It's very yellow, so you may recognize it in yellow curries and things like that. But curcumin, the active ingredient in it, actually has a lot of good properties. It has anti-inflammatory properties, it has antibacterial properties, and perhaps even anti-cancer properties as well. So it can be helpful in an inflammatory state. So there actually has been studies looking at ulcerative colitis patients where they took active curcumin. In one of the most recent studies, it's still a couple of years ago, and they used 3 grams of curcumin and compared that to placebo tablets. And they had patients that had ulcerative colitis. They underwent colonoscopy. We found active inflammation. They were treated with maximum dose of mesalamine. And we randomized them. So it's a clinical trial where the patient did not know what they were getting. The gastroenterologist did not know what the patient was getting. They randomized them to get these supplements or the placebo. And what they found out after a few weeks of being on it, the patients who got the curcumin actually had healing. More patients had healing of their colon from their colitis than they did from the placebo. No one improved on the placebo. So there is some benefit potential to this. The only thing is it is a food, so it's not an FDA-approved medication per se. The only thing is in the clinical study, of course, this was done under lab and made sure that this was 99.9% pure curcumin. Of course, over the counter, we can't really confirm that, but you can find curcumin over the counter in Whole Foods and health food stores and all of that, or you can take a ton of curcumin or turmeric in your foods as well.
Okay. So if you're on medication, one of the viewers want to know for irritable bowel syndrome.
Okay.
Can your diet cause a flare-up, or do those medications that they're taking kind of keep that under control?
So it can go either way. So diet, we know, plays a big role, be it either irritable bowel syndrome or inflammatory bowel disease, where you could be feeling fine, but you do something bad with your diet. You went on a drinking 7, Diet Cokes a day, or eating steak every day for breakfast, lunch, and dinner. I'm talking about the extreme here, but go into eating unhealthy, for example, that can potentially trigger the stress in your gut that can cause more of the symptoms for IBS. It may also change the microbiome in your gut, where it can also trigger inflammation as well. So that can happen. Now, for the most part, at least I know from my patients that have inflammatory bowel disease, they're under control, in remission of their disease on medical therapy. It's much less frequent for you to go into a flare with a diet change compared to if the disease was still not under control.
So if you have an IBS flare-up, what can patients do about the bloating? Is there medication they can take or something they can drink?
Yeah, so of course we all want a quick fix. The question really becomes, is the symptom from something that was triggered? So if the key is to go back and find out if there was a specific trigger. If it was related to the diet, then of course adjust the diet. But if, sometimes that can happen, it could have been related to the diet. Well, we'll need to change that for the future, but how do you treat the bloating? And often over-the-counter medications that block the gas, like Gas-X or simethicone type of ingredients can help with that. Sometimes just changing the diet in itself and eating healthier, once all the gas comes out can, be beneficial in preventing it from happening again. Okay. Sometimes you can get an entity called small intestinal bacterial overgrowth, and that could be from another source or having prior surgeries in your gut or blockages or whatnot, and that can sometimes cause a lot more gas, bloating, or even diarrhea. So if that happens, sometimes you may need to be on antibiotics to get rid of the bacterial overgrowth and help reduce the bloating that way. And of course, there are certain foods that tend to cause more bloating and gas than others. And so we work with the dietitian to help with adjusting the diet to reduce certain foods that tend to cause more gas and reducing the amount that you take of that, so hopefully that will reduce the bloating as well.
Okay. So Rachel has another question. She wants to know, what does it mean to be in IBD remission? Is there such a thing?
Okay. So IBD remission is having inflammatory bowel disease, but in remission, meaning the disease is under control. Now, when we talk about remission, there's clinical remission, there's endoscopic remission, and there's histological remission. So let me go through all these three.
Okay.
Ideal would be the third one.
Okay.
So clinical remission is when the patient that has IBD has no symptoms of their disease. So they feel fine, they're not having any pain or diarrhea or bleeding. All the symptoms are gone. They feel back to their complete normal health. Now, that's great, but sometimes you can feel great and you can still have inflammation. And so when we do the colonoscopy, that's why even though you feel well and you've had disease in the past, I always like to repeat a colonoscopy after whatever treatment we chose to make sure the colon is healed up or the intestines are healed up. And if we get to that point, I look and I see, gosh, there used to be an ulcer here. Now it's no longer. It's all healed up. That's great. That means you're in endoscopic remission. Now, on the other hand, you can look like you're healed up, but when I take biopsies and we send it to the pathologist, sometimes they may still be able to see inflammatory cells under the microscope. So that means there's still histological activity. So ideally, when we go in there and I scope and we see that the colon looks great and we take biopsies and the pathologist sees completely normal, healthy cells, no inflammation, not even inflammatory cells, that's where we can say is true histological remission or histological normalcy. So that would be the best ideal goal, because if you get to the histological remission component, then not only are you not going to have a flare anytime soon, your risk of even colon cancer also goes down drastically as well.
Okay, fantastic.
Yeah.
Well, we had a question from Rukia. She wanted to know if any detox, which detox would you recommend? I mean, we see commercials about these things all the time. So what is a good one? Or what should people be looking for?
Okay, so I guess it depends on what we're talking about in detox. Are you talking about the Hollywood detox diet, or you take something and you're slim for your, I don't know, Oscars for the next day?
Well, those always sound kind of drastic.
Drastic,
How
okay.
about just for the normal
Yeah,
everyday person?
so I don't necessarily recommend any specific detox treatments because anything that, I'm assuming this is about cleansing the colon potentially,
exactly.
Because our body does a great job on its own of, cleansing ourselves. We eat, our bodies, our intestines are there to absorb nutrients, our colon's there to absorb water, store the stool, and expel it as normal body function. Now, if you were to take something to cleanse out your colon, which to me I think makes no sense because our body's doing that anyway, we're also could be stripping off the normal bacteria as well. We don't want to do that. So if you're healthy, then you don't want to be doing anything to change your normal microbiome that's keeping your gut healthy as well. Yeah.
Because they just sound like it's awful.
Yeah,
It just sounds
If
awful.
it sounds awful, let's not try it. Now, on the other hand, people talk about detoxing themselves by eating a healthier diet, perhaps going, drinking more green tea, and avoiding too much the unhealthy foods, becoming vegetarian for a day or whatnot, or adjusting that. Then I think that's completely fine. Especially, it's nice to detox after you ate a heavy meal or been eating too heavily for a good week because you were traveling. Get back home and go, I need to detox, I need to eat healthy, I need to just maybe fast for half a day or something, have some tea. That I think is completely fine, but going on and taking some sort of over-the-counter herbal supplement that we don't know what's going to cause, not just the GI tract but liver, kidneys, that I do not necessarily recommend. Yeah.
Okay, so Dawn out in the Facebook audience wants to know, what is gastritis?
Gastritis, okay. So itis in Latin means inflammation of, and gastric means of the stomach. So that's a generic term for inflammation of the stomach. Now you can get gastritis, some people might say, oh, I have gastritis, where it's just this clinical diagnosis of I have some stomach pain.
Right.
But true gastritis means there's some sort of inflammation in the stomach, and that could be from just too much acid production. We're normally producing that anyway, but sometimes stress. We could talk about stress gastritis. We can also get gastritis, or we call it more gastropathy, or some sort of pathology in the stomach from taking too much NSAIDs. These are type of medications that include aspirin, ibuprofen, naproxen type agents, where it can actually irritate your GI tract, the stomach, including the rest of the GI tract, where it can sometimes cause gastritis or or ulcers, I should say. So there's medication-related gastritis as well. And there's another entity called infectious gastritis, where one bacteria called Helicobacter pylori is probably one of the very few bacteria that can actually survive the acid environment in the stomach, and that can cause gastritis or even ulcers there as well.
Okay. Ansley wants to know, have you ever seen any cardiac issues in relation to IBD?
So yes, inflammatory bowel disease, even though we talk about bowel disease, you can have what we call extraintestinal manifestations, where some patients can get joint pains or skin rashes. So we know there is an extraintestinal component of that. Now, cardiac disease is pretty rare to have in link to inflammatory bowel disease, but that doesn't mean we haven't seen it. It's mostly seen in like case reports or rare incidences of one patient having some sort of cardiac disease linked to that. Now, the key here would be to differentiate, is it something completely separate or is it really linked to the disease? Because the cardiac disease, even though it could be linked, is very rare. The key is to make sure it's not a completely different phenomenon or component going on than being directly linked to IBD. Now, sometimes medications may cause cardiac disease, so we need to also differentiate if it's from medical therapy that's causing it too.
So do patients often ask you about the best diets for their gut health? And if so, maybe what would be those best diets?
So I'd say go back to what our mom said, right? Eat our vegetables, eating more roughage.
Yeah.
So valid question. Of course, eating healthy would be a generic answer. However, if you have, let's say, Crohn's disease, and if you have a small bowel blockage or narrowing, then eating healthy would be the wrong answer because all the roughage can cause more blockage in those patients. So if that's the case, then we have to treat it individually to that specific patient. So if there's some narrowing, we may keep them off of a high fiber diet initially, treat them medically, or if they need surgery, treat that area that's strictured, and once they're healed from the surgery, then they should be able to get back to eating healthy again.
Ahmad wants to know, is GI map a good test, and what does it help diagnose?
So is he talking about the, is that a specific test looking at the mycobacteria testing? So
Let's go with that.
Okay, I'm assuming that's what it is, but it depends on what you're testing for.
Okay.
So it's a very specific test. So the question would be, well, what type of symptoms do you have? So that's not the number one test that we go for someone who presents to us from GI disease.
Okay. Okay. And then Ansley wants to know, when taking a steroid for IBD, is it good to also take a PPI or H2 receptor
blocker? Okay, so taking steroids or prednisone or corticosteroids for inflammation IBD, we try to avoid that medicine first of all, if possible, but sometimes we need to use it because it works quickly, but sometimes it can cause irritation, gastritis, or just dyspepsia as well. So yes, if you take prednisone or some sort of corticosteroid like that, and that tends to cause stomach pain or gastritis or issues to that, then yes, I'd recommend using an H2 blocker or a PPI, which is a proton pump inhibitor. These block or reduce the acid production in the stomach. That can help with that as long as the patient's on the prednisone, and then once they're off of it, then they may be able to get off of the other acid blocking medication as well.
Well, doctor, you have covered a lot of ground here. Is there anything else that people might want to know about that I haven't asked, that people out there have not asked, that we should know about?
Yeah, so I guess the key is, GI tract related symptoms can come and go. Often it's something that we ate or related to, some food or a bug or whatnot, and typically that clears up. But the key is look for any alarm symptoms, symptoms that are not getting better after a few days, rectal bleeding, losing weight, pain that's not getting better. Those things need to be evaluated, so I would recommend everyone getting checked up if some things are prolonging and not getting better. Yeah.
Well, Dr. Abraham, thank you so much for joining us today. The information you gave was tremendous.
Okay, great.
Thank you so much.
Thank you.
Join us next month on July 25th for Facebook Live. We're actually going to take the show on the road to Houston Methodist, the Woodlands Hospital, talk to Dr. Matthew Sewell about skin cancer that can affect many of us during the summer months. So once again, thank you for joining us. If you have more questions, feel free to leave them in the comment section, and we will try to get Dr. Abraham to answer them for you. Thanks again, and we will see you next month.